You know, lower back pain is one of those problems seemingly everyone has, but yet there's no simple cure. It affects millions of Americans of all ages and costs us nearly $90 billion in healthcare costs every year. So today we're discussing some new trends in treating lower back pain. And joining me now is Dr. Andrew Dold, orthopedic surgeon at Baylor Scott & White Health. Thank you so much for joining us this afternoon, doctor.
Thanks for having me.
So let's start off by sort of breaking down the different types of back pain people may be experiencing.
Yeah, so I think one of the easier ways to classify back pain would be problems associated with the intervertebral disc. You've probably heard of a herniated disc before, and then all of the other problems. So those could be problems related to the muscles of the lower back, maybe the ligaments, or even the other joints such as the facet joints.
Because we know this is not just the spine or the back itself. The body is all interconnected, so you've got issues other places that could be playing into the lower back pain that you're having, right?
Absolutely, and the spine has a complex set of nerves down in the lower back where you can get referred pain. For instance, hip arthritis can commonly present as lower back pain. So I think one of the important things early on is to establish the correct diagnosis.
And we of course know the nervous system is complicated, but why is it so hard to just figure out how to treat back pain?
Yeah, I think one of the reasons is just because there's so many causes that could be responsible for the pain that often patients go and see their physician and we're really not entirely sure what the actual underlying cause is. So at first I think it's important to get the right workup to understand what the underlying etiology is responsible for the pain, and then you can go from there in terms of identifying the correct treatment approach.
We're not just talking about maybe senior citizens or people who may be unhealthy. We're also seeing lower back pain in younger people, in athletes, people you would consider healthy. So it's either, I mean, people assume something causes it, but then you also have cases where it sort of just comes up on its own.
Yeah, I think a lot of growing pains can be manifest as lower back pain in young athletes. I see in my clinic, they often present with back pain when there's not really an associated cause that we can find, and often we just attribute this to the skeleton just growing.
Interesting. So now when we're talking about managing this pain, you're talking about, you know, certain prescription drugs, and we know with this opioid epidemic, at this point now there are new guidelines and doctors are trying new methods now, sort of steering away from those opioid medications to sort of manage that back pain. Let's talk about that.
Yeah, so I think there has been a few guidelines that have come out more recently, and there's been this opioid epidemic that's been sweeping the country right now. So doctors are concerned about that, and I don't ever think that prescribing a narcotic analgesic is going to be the first line therapy for any sort of back pain or presentation of back pain.
The thing is though, doctor, this can be so frustrating for people because you're feeling it when you're standing, when you're sitting, when you're dancing, when you're walking, all the time. Some people are so desperate for a fix, they'll even consider surgery. So when is surgery the route to go, and when should we, you know, be considering other options before we get to that point?
Yeah, so that's a good question. I think that surgery encompasses a very, very small margin of the treatment of all back pains. As you said, it's very, very common. I think the majority of Americans are going to experience some form of back pain throughout their lives, and surgery makes up a very, very tiny fraction of the treatment algorithm. Other modalities to consider would be non-opioid medications such as anti-inflammatories, of course physical therapy, acupuncture, core strengthening programs such as flexion and extension exercises, and so on.
And I'm glad you mentioned that, doctor, because when we come back in the next half hour, we're going to actually demonstrate some of those exercises you can do to help manage that pain and strengthen the muscles to hopefully make that pain less of a problem. So Dr. Dold, thank you so much for joining us this afternoon. Really appreciate it.